Have you ever felt a sudden, sharp pain in your chest and struggled to breathe? It could be a sign of something serious, like a pulmonary embolism. Let's dive into what this condition is all about. Pulmonary embolism, or PE, typically occurs when a blood clot, most often from the deep veins in your legs, travels through the bloodstream and lodges in the pulmonary arteries, blocking blood flow to the lungs. This is known as deep vein thrombosis, or DVT. Less common causes include fat, air, or even tumor cells that enter the bloodstream. Certain factors like prolonged immobility, surgery, cancer, pregnancy, and genetic clotting disorders can increase your risk of developing DVT and subsequently, PE. Okay, let's understand what happens inside. When a blood clot blocks a pulmonary artery, it restricts blood flow to a section of the lung. This leads to a decrease in oxygen levels in the blood. The heart then has to work harder to pump blood through the remaining unobstructed vessels, which can increase pressure in the pulmonary arteries. This increased pressure, known as pulmonary hypertension, can eventually lead to right heart failure if the embolism is large or if there are multiple emboli. Pulmonary embolism is a surprisingly common condition. It is estimated to affect hundreds of thousands of people worldwide each year, although many cases go undiagnosed. The incidence increases with age, and it's more prevalent in individuals with underlying medical conditions. Understanding how common this is reinforces the importance of recognizing the symptoms and seeking prompt medical attention. The symptoms of pulmonary embolism can vary widely depending on the size of the clot and the overall health of the individual. Common symptoms include sudden shortness of breath, chest pain that worsens with deep breathing or coughing, lightheadedness, rapid heart rate, and coughing up blood. Some people may also experience leg pain or swelling if the clot originated in the leg. It's important to remember that not everyone will experience all these symptoms, and some may be subtle. Diagnosing pulmonary embolism can be challenging as symptoms often mimic other conditions. Doctors often use a combination of tests. First, a physical exam to check your symptoms and medical history. Then a D-dimer blood test to see if there's a blood clot in your body. If this is elevated, imaging tests like a CT pulmonary angiogram, also known as a CTPA, is usually performed. This is the gold standard for diagnosis. In some cases, a VOQ scan, which looks at airflow and blood flow in the lungs, or a pulmonary angiogram, which directly visualizes the pulmonary arteries, may be used. Pulmonary embolism can be classified based on the severity and location of the clot. Massive P refers to a large clot causing significant hemodynamic instability, such as dangerously low blood pressure. Submassive P involves a smaller clot but still causes right heart strain. Low-risk P involves a small clot without significant hemodynamic compromise or right heart strain. The primary goal of treatment is to prevent the clot from growing and to prevent new clots from forming. Anticoagulant medications, also known as blood thinners, are the cornerstone of treatment. These medications can be administered orally or intravenously. In severe cases, thrombolytic therapy, which dissolves the clot, may be necessary. In rare cases, surgical removal of the clot, or a procedure to break up the clot called catheter-directed thrombolysis may be required. Supportive care, such as oxygen therapy and pain management, is also an important part of treatment. Preventing pulmonary embolism primarily involves preventing the formation of blood clots in the first place. This includes measures such as wearing compression stockings, taking anticoagulant medication as prescribed, especially after surgery or during prolonged immobility, regular exercise, maintaining a healthy weight, and avoiding prolonged periods of sitting or standing can also help. If you are at high risk, talk to your doctor about preventative strategies. The prognosis for pulmonary embolism varies depending on the size of the clot, the individual's overall health, and the promptness of treatment. With timely diagnosis and appropriate treatment, many people recover fully. However, large clots or delayed treatment can lead to serious complications, including chronic pulmonary hypertension and even death. Recent research focuses on improving diagnostic accuracy, developing more effective anticoagulant therapies, and identifying individuals at high risk for recurrence. There is also focus on developing strategies to prevent chronic thromboembolic pulmonary hypertension after a PE.